When joint pain sets in, the assumption is mechanical. We picture joints like heavy steel hinges, grinding down through physical friction. Medically, arthritis functions as an umbrella term for dozens of distinct conditions that affect the body in specific, highly variable ways. These conditions share a destructive baseline: persistent pain, localized swelling, severe stiffness, and sudden flare-ups where symptoms rapidly intensify. Dismissing an immune-driven inflammatory response as simple mechanical aging causes significant delays in treatment, allowing the condition to progress unchecked. That initial joint pain is a critical warning signal, demanding precise medical identification before irreversible structural degradation occurs. Because these diseases share overlapping symptoms, NHS guidelines explicitly warn against attempting to self-diagnose. This matrix shows how these conditions strike. Osteoarthritis, the most common form, attacks weight-bearing joints like knees and feet starting in the late 40s. Rheumatoid arthritis usually hits the small joints in hands and feet between 40 and 60. Other conditions are defined by specific locations. Gout frequently targets the big toe in older adults, causing hot, swollen pain. Ankylosing spondylitis focuses on the lower back and usually begins in patients under the age of 40. Some types are marked by visual or demographic profiles. Psoriatic arthritis arrives with a red, scaly skin rash called psoriasis, while juvenile idiopathic arthritis, or JIA, exclusively affects children under the age of 16. Applying a mechanical knee degradation protocol to a pediatric immune condition or treating an autoimmune rash like a simple repetitive strain injury is ineffective. The specific joint affected and the age of onset are critical data points. Identifying the exact clinical profile is the only way to access a treatment plan that actually works. The baseline threshold for seeking medical help is unexplained joint pain, swelling, or stiffness that does not resolve within a few days. This flowchart maps the diagnostic pipeline, splitting based on symptom severity. The urgent path is triggered by red flags, requiring an immediate GP or NHS 111 call, starting with sudden, severe swelling and hot skin in a single joint. It also includes systemic complications like a temperature, vision problems, or rashes. For chronic pain, a rheumatologist investigates joint structures using X-rays and ultrasounds. They also check for chemical markers through blood work or by extracting joint fluid to confirm conditions like gout. Navigating this diagnostic pipeline involves scheduling friction and minor invasive discomfort, but it is necessary to secure a definitive answer. Avoiding diagnostic tests out of convenience risks permanent structural damage to the joint. There is currently no cure for arthritis. Medical intervention focuses entirely on aggressive symptom management. Physiotherapy is used to build strength and mobility in the muscles surrounding the joint, which requires a significant time investment from the patient. Occupational therapy focuses on everyday survival, requiring patients to adapt how they perform tasks, like washing up in the morning, dressing for the day, and safely cooking meals. Doctors use targeted medicines to reduce systemic inflammation and suppress immune activity, alongside equipment like walking aids and wheelchairs to ease daily physical friction. You can accelerate access to therapies by referring yourself to NHS Community Musculoskeletal, or MSK, services. MSK services specialize in treating injuries and conditions affecting the muscles, joints, and soft tissues, and you do not need a GP referral to use them. Professional therapy focuses on strengthening the surrounding physical infrastructure to maintain independent movement. Clinical interventions must be matched by consistent daily habits at home, starting with weight management. Maintaining a healthy weight is a mechanical necessity. Being overweight puts direct physical strain on weight-bearing joints, accelerating their breakdown. High-impact activities must be replaced with strictly low-impact exercises like swimming, daily walking routines, and mindful Pilates. The NHS guidelines also require complete cessation of smoking and limited alcohol intake to prevent the artificial worsening of symptoms. Preserving long-term mobility requires replacing high-impact habits with low-impact alternatives and monitoring daily physical inputs to prevent flare-ups. Arthritis demands proactive daily effort to stave off the loss of mobility. This scorecard breaks down the next steps. If you have unexplained pain, stop relying on over-the-counter painkillers and book a GP appointment for diagnostic testing. For those already diagnosed, utilize MSK self-referrals for therapy and prioritize strict weight management and low-impact movement. Ignoring the condition or relying on passive treatments guarantees that joint degradation will accelerate. Committing to proactive lifestyle changes and therapeutic management is the only proven method to preserve long-term mobility and independence. For more definitive, objective health guides, like, share, and subscribe to Inside Anchor.